Mr. Smith was discharged home with a close follow-up with cardiology, our last guy. Unfortunately, he did not make his appointment. The meds were too expensive for him, and he ended up back at the hospital. The ER calls you back to readmit the patient only 3 weeks after he was discharged. He tells you that the patient's chest X-ray now shows a large pleural effusion, and once I'm admitted, the patient is now on 3 liters of oxygen nasal cannula. How can you help him at this time? So a pleural effusion is actually fluid that's not like pulmonary edema inside the lung in the interstitium, but pleural effusion is fluid outside the lung in the pleural cavity, okay? So before we talk about pleural effusion, I want to give you a little bit of an introduction about how we give patients oxygen in the hospital. The normal air that I'm breathing right now and you're breathing right now contains about 21% of oxygen, okay? The rest of that 79% contains other stuff, but 21% of that contains oxygen. So when patients have respiratory distress, we try to put them on oxygen, supplement them on oxygen. Oxygen is a medication at the end of the day. So we give them oxygen so that we can keep their oxygen saturation, which is what, when we put the pulse oximetry on their finger, we keep that above 90%. So think about these as low flow oxygen delivery systems and high flow oxygen delivery systems. So when you're putting the pulse oximetry on a patient's finger, you're actually measuring how much hemoglobin is saturated with oxygen. I find this pulse oximetry astonishing. I mean, how does this little thing that goes in your finger measure how much hemoglobin is saturated with oxygen? But it does. And that's what we call hypoxia, which is different than hypoxemia, which is the oxygen that you measure with the ABG or VBG. So low flow oxygen delivery systems, oxygen nasal cannula. So that's the one, that goes into your nose, a little tube that can go from 1 liter to 6 liters. 1 liter contains about 24%. FiO2 means concentration of oxygen. 6 liter contains about 44% of oxygen. So that's almost double of what you and I are breathing right now.